A 29 years old man has sore throat for the past 5 days. Over the past 24 hours, he noticed increasingly throbbing pain in the region of the right tonsil. He is pyrexial and on examination noted to have swelling in this area. What is most likely diagnosis? So it is very obvious scenario that a patient suffering from the sore throat, that means the throat pain, and which is increasingly throbbing pain, and this is the most important diagnostic point, that when there is throbbing pain, that means it is the abscess. When there is throbbing pain, that means it is the abscess. So there is the abscess in the right tonsillar area. Then the patient present pyrexia and there is a swelling of this area. So in the right tonsillar area there is abscess present. So what is the cause of this abscess, or what is this abscess? Here the options are the tonsillar cancer, lymphoma, quinsy, glandular fever and common cold. So what may be the answer? So first of all, let's see, this is a right sided tonsil, and here we can see the tonsil is hugely enlarged, and the outside of tonsil there is white patch, that means it is the acute tonsilitis. And what happened around the tonsil, there is pus deposition occurs in sometimes, and in this condition throbbing pain develop. So in this condition throbbing pain develop when there is abscess around this tonsil. So let's see first of all the acute tonsillitis. So what is acute tonsillitis? Acute tonsillitis is the acute infection of the tonsil, and it is characterized by the pharyngitis, that means the infection or inflammation of the pharynx, fever, malaise and lymphadenopathy. So fever, malaise, lymphadenopathy, pharyngitis, they are the clinical feature of the acute tonsillitis. Over half of the cause, it is by the Streptococcus pyogenes. So Streptococcus pyogenes, it is the main pathogenic organism for the development of the acute tonsillitis. Tonsil are typically edematous, yellow or white pustule present, and in the previous picture here we can see this is the white pustule. Infectious mononucleosis is maybe mimic this condition. In case of the infectious mononucleosis, in this condition also there is a sore throat, there is fever, but there the splenomegaly and other generalized lymphadenopathy may be present. So the other feature like the splenomegaly, lymphadenopathy present in this condition, infectious mononucleosis can be the alternative. What is the treatment? Treatment is the penicillin. Penicillin is the treatment of the acute tonsillitis, but here keep in mind that this may be resistant in some case. And the bacterial tonsillitis may result local abscess formation, and this abscess formation is known as the quinsy. So the abscess formation in the tonsil, it is known as the quinsy or paratonsillar abscess. And unilateral swelling with fever is usually indicated of the quinsy. Quinsy means paratonsillar abscess, and our clinical feature, it is right sided tonsil enlargement and also fever. So it is quinsy, that means the paratonsillar abscess. And what is the treatment? When there is abscess, go for incision and drainage. So as it is abscess, quinsy is abscess, so what is treatment option? Treatment option is the incision and drainage. So what is the diagnosis? Diagnosis is quinsy or paratonsillar abscess or paratonsillar abscess. Why abscess? Because there is a severe throbbing pain, and there is the unilateral, that means the right tonsil. So unilateral tonsil, severe throbbing pain, also fever, they are the diagnostic point for the quinsy or paratonsillar abscess.